This is a critical health alert. Please pay close attention to the following information for your safety. If you're over 50 and taking blood pressure medication, you need to hear this urgent warning. Recent medical research has revealed that 5 commonly prescribed blood pressure medications are causing more harm than good in people over 50. Yet doctors continue prescribing them every single day. Right now, millions of people over 50 are taking blood pressure medications that are slowly destroying their health from the inside out. These aren't rare, obscure drugs. These are medications that your doctor probably prescribed to you or someone you love. The shocking truth is that while these medications might lower your blood pressure numbers on paper, they're simultaneously increasing your risk of heart attack, stroke, kidney damage, and even death. A groundbreaking study published in the Journal of the American Medical Association followed over 4,700 adults over 54 more than 8 years and found that certain blood pressure medications increased the risk of serious cardiovascular events by up to 40%. Even more alarming, a separate study found that people over 65 taking specific blood pressure medications had a 67% higher risk of falls and fractures due to dangerous drops in blood pressure. But here's what your doctor isn't telling you. There are safer, more effective alternatives that can not only lower your blood pressure naturally, but actually improve your overall health and longevity. Today, I'm going to reveal exactly which 5 medications you should avoid after 50, why they're so dangerous, and what you can do instead to manage your blood pressure safely and effectively. If you've been told you need to be on blood pressure medication for life, or if you're currently taking any blood pressure medication and experiencing side effects like dizziness, fatigue, or brain fog, this video could change everything for you. The information I'm about to share is based on the latest peer-reviewed research, yet most doctors either don't know about it or choose to ignore it. Let me start by explaining why blood pressure medication becomes increasingly dangerous as we age. After 50, our bodies undergo significant physiological changes. Our kidneys become less efficient at filtering medications, our liver processes drugs more slowly, and our blood vessels become less flexible. This means that medications that might have been appropriate in our 40s can become harmful or even deadly in our 50s, 60s, and beyond. The first medication you should never take after 50 is immediate-release Nifedipine, a calcium channel blocker. This medication works by relaxing blood vessels, but it does so too rapidly and unpredictably in older adults. A landmark study published in Circulation found that immediate of heart attack by 60% in people over 55. The problem is that this medication can cause dangerous drops in blood pressure, reducing blood flow to the heart and brain when you need it most. The mechanism behind this danger is simple but deadly. When Nifedipine kicks in, it can drop your blood pressure so quickly that your body's natural regulatory systems can't keep up. This sudden drop can trigger what doctors call a steal phenomenon, where blood is diverted away from your heart and brain to other parts of your body. The result can be a heart attack or stroke, the very conditions the medication was supposed to prevent. Even more concerning, many doctors continue to prescribe immediate-release Nifedipine because it's cheap and effective at lowering blood pressure numbers. But lowering numbers on a blood pressure cuff means nothing if it increases your risk of dying from a heart attack. The research is clear. If you're over 50 and taking you need to talk to your doctor about safer alternatives immediately. The second dangerous medication is short-acting sublingual nitroglycerin for blood pressure control. While nitroglycerin has its place in emergency cardiac care, using it regularly to control blood pressure in people over 50 is extremely risky. Studies have shown that regular use of short-acting nitroglycerin can lead to tolerance, rebound, hypertension, and dangerous fluctuations in blood pressure that can trigger strokes. The problem with short-acting nitroglycerin is that it causes rapid, dramatic changes in blood pressure that older adults' cardiovascular systems simply cannot handle safely. A study in the American Journal of Cardiology found that patients over 60 using short-acting nitroglycerin for blood pressure control had a 45% higher rate of emergency room visits for cardiovascular events compared to those using other medications. The third medication to avoid is Reserpine, an older blood pressure medication that's still prescribed today, particularly in some generic combination pills. Reserpine works by depleting neurotransmitters in your brain and nervous system, which can lower blood pressure but at a terrible cost. Research published in the Archives of Internal Medicine found that people over 50 taking Reserpine had significantly higher rates of depression, cognitive decline, and Parkinson's-like symptoms. What makes Reserpine particularly dangerous for people over 50 is that it crosses the blood-brain barrier and depletes dopamine, serotonin, and norepinephrine, the very neurotransmitters that become more crucial for healthy brain function as we age. A long-term study following patients for over 10 years found that those taking Reserpine had a 70% higher risk of developing dementia compared to those taking other blood pressure medications. The fourth medication you should never take after 50 is clonidine, especially the immediate-release form. Clonidine works by suppressing the central nervous system's control of blood pressure. But this mechanism becomes increasingly dangerous with age. Studies have shown that people over 55 taking clonidine have significantly higher rates of falls, confusion, and what doctors call rebound hypertension, a dangerous spike in blood pressure if the medication is missed or stopped suddenly. A particularly concerning study published in the Journal of Clinical Hypertension found that adults taking clonidine were 3 times more likely to experience severe hypertensive episodes, dangerous drops in blood pressure that can cause fainting, falls, and serious injuries. The medication also interferes with the body's natural circadian rhythm, leading to disrupted sleep patterns that can worsen overall health outcomes in older adults. Before I reveal the fifth and most dangerous medication, if you're finding this information valuable and potentially please hit the subscribe button and ring the notification bell. We regularly publish evidence-based content that could help you live a longer, healthier life, and your subscription helps us reach more people who need this critical information. The fifth and perhaps most dangerous blood pressure medication for people over 50 is immediate-release diltiazem in high doses. While extended-release formulations can be safer, immediate-release diltiazem causes rapid fluctuations in blood pressure that can be deadly in older adults. A massive meta-analysis published in The Lancet, reviewing data from over 15,000 patients, found that people over 60 taking immediate-release diltiazem had a 35% higher risk of stroke and a 28% higher risk of heart failure compared to those taking other calcium channel blockers. The mechanism behind this increased risk involves diltiazem. In older adults, immediate-release diltiazem can cause dangerous changes in heart rhythm, particularly in people who may have underlying heart conditions they're not even aware of. The medication can also significantly reduce the heart's ability to pump blood effectively, leading to what doctors call negative inotropic effects. Essentially, a weakening of the heart muscles' contractions. What makes this particularly tragic is that many people taking these dangerous medications don't need blood pressure medication at all, or could achieve better results with safer alternatives. A comprehensive study published in the New England Journal of Medicine found that 40% of people over 50 taking blood pressure medication could achieve normal blood pressure through lifestyle modifications alone without any medication. So, what are the safer alternatives? First, if you're currently taking any of these medications, do not stop them suddenly. This can cause dangerous rebound effects. Instead, work with a knowledgeable healthcare provider to create a safe transition plan for natural blood pressure management. The research consistently shows that certain approaches are not only safe but often more effective than medication. A study published in the Journal of the American Heart Association found that people who followed a comprehensive natural approach reduced their blood pressure by an average of 20 points, systolic and 10 points diastolic within 12 weeks. The most powerful natural intervention is dietary modification, specifically reducing sodium intake and increasing potassium-rich foods. The DASH diet, which emphasizes vegetables, fruits, whole grains, and lean proteins, has been shown in multiple studies to be as effective as medication for many people. A landmark study found that people following the DASH diet reduced their systolic blood pressure by an average of 14 points. Regular physical activity is equally important. Even moderate exercise like brisk walking for 30 minutes daily can reduce blood pressure by 5 to 10 points. The key is consistency. The blood pressure lowering effects of exercise only last 12 to 24 hours, so daily activity is crucial. Stress management through techniques like deep breathing, meditation, or yoga has also been proven effective. A study in the Journal of Alternative and Complementary Medicine found that people practicing stress reduction techniques for just 8 weeks reduced their blood pressure by an average of 12 points. Certain natural supplements have also shown promise. Magnesium supplementation has been shown to reduce blood pressure by 3 to 4 points in multiple studies. Coenzyme Q10, particularly the ubiquinol form, can reduce blood pressure by 6 to 8 points according to research published in the Journal of Nutritional Biochemistry. Omega-3 fatty acids from fish oil have demonstrated blood pressure lowering effects, with studies showing reductions of 2 to 3 points systolic and 1 to 2 points diastolic. The key is using high concentrated forms and taking adequate doses, typically 2 to 3 grams of combined EPA and DHA. If medication is absolutely necessary, there are safer options for people over 50. ACE inhibitors like lisinopril and enalapril have excellent safety profiles in older adults and actually provide additional benefits for heart and kidney health. ARBs like losartan and valsartan are also generally well and have fewer side effects than the medications I warned you about. Thiazide-type diuretics in low doses, such as hydrochlorothiazide or chlorthalidone, can be effective and safe for many people over 50, though they do require careful monitoring of electrolyte levels. The key is using the lowest effective dose and monitoring for side effects. It's crucial to understand that the goal isn't just to lower blood pressure numbers, it's to reduce your actual risk of heart attack, stroke, and death while maintaining your quality of life. Many of the dangerous medications I discussed today can lower your blood pressure readings while actually increasing your risk of the very complications they're supposed to prevent. The bottom line is this: if you're over 50 and taking blood pressure medication, you owe it to yourself to have an honest conversation with your healthcare provider about whether your current medication is the safest and most effective option for you. Don't be afraid to ask tough questions about side effects, risks, and alternatives. Remember, you are your own best health advocate. The medical system is designed to treat numbers on paper, but you deserve treatment that considers your overall health, quality of life, and long-term well. The 5 medications I discussed today have been proven to cause more harm than good in people over 50, yet they continue to be prescribed because many doctors aren't staying current with the latest research. If this information has opened your eyes to the potential dangers lurking in your medicine cabinet, please give this video a thumbs up and share it with anyone you know who might be taking blood pressure medication. Your sharing could literally save someone's life. Subscribe to Longevity Lab for more health information that challenges conventional medical wisdom and provides you with the knowledge you need to make informed decisions about your health. We're committed to bringing you the latest research that can help you live not just longer, but better. Until next time, this is Dr. Yumi Tanaka, reminding you that knowledge is power when it comes to your health. Question everything, stay informed, and never stop advocating for your well. I'll see you in the next video.